Well, you got half a page of wisdom over there.
Yeah, and something else on the entrance ramp here, leaving the studio, getting up on 59, heading east. There's a great big sign up there that says zero premium Medicare Advantage. So,
are you going to rant about that?
Beware. No, it's just something. It's a sign up there, and it's a big lie. All they want to do is get you to flip to Medicare Advantage, and they'll take advantage of you.
Let's go ahead and start with just a little 2-minute thing here on Medicare Advantage versus traditional Medicare. First of all, let me tell folks that if you can afford, if it may put you out a little bit, if you can afford traditional Medicare, it is what is best for you. It's the policy. It's what we all call that policy that gives you, the American citizen, the most freedom, because it is you who chooses your doctor. It is you who chooses your health care. That is a government saying, over the decades after decades of you being an employee, of you being a worker, of you being a business person, every single day of your life, every single payment you received, you paid about 3%. And it doesn't matter if you made $10 or if you made $1 million. 3% of that was your premium to Medicare. And for that, we the people, your government, promised you real health care. Now, it also said, because it's sort of an insurance plan, that we are going to pay 80% of your costs, and you would be responsible for 20% of your costs. Let me tell you a dirty little secret. Well, actually, this one isn't dirty. The truth of the matter is, a lot of doctors out there, they know that a lot of people, poor people included, are on standard Medicare. And a lot of times they'll kind of waive the 20%. They won't advertise that, but you can kind of get them to waive the 20% that you owe them. Because again, the way it works is a lot of times they even kind of bill a little bit freely. Now, that said, again, remember that traditional Medicare, you get the health care that you need by the doctors that you want. Now, you know how we talk about capitalism and the private sector. I am for the private sector. I am just not for the private sector abusing you, which is by definition what that C word does. Now, there's this stuff that these guys, first of all, Medicare came into be, one of the reasons, because private insurance would not insure older people. Because older people do what? They get sick more often than younger people. So they decided that we can't make money insuring older people. So we the people came to your rescue. All Americans came to the rescue of our older folks, also realizing that we all eventually get older. Now the government took over and it says, okay, we'll pay the premiums for for your health care. You will contribute all your working life. You will contribute 3% of your salary. And by when you're done working and become 65 years old, we will start paying for your health care. The private sector said, wow, there is a bunch of money to be made. Medicare standard didn't cover eyes, ears, and teeth, and it's 20%. So it has some cost to the average person. So Medicare has always allowed the private sector to insure that section, that 20%, and the dental and the health and that sort of stuff. And the private sector came in and they made a little bit of money by doing that. The government still took care of the major part of the cost. But that's not enough for the private sector, for the capitalist sector. They said, wait a minute, there are billions and billions and billions and billions of dollars there. Why don't we create something sort of Medicare-like, make it sound pretty, and convince the government to pay us a fixed cost for every single person that sign up with us that's on Medicare? So the capitalists come in now and they say, okay, government, we'll pay you bribes, the lobbyists, for you to vote on allowing something called Medicare Advantage. It's really private insurance governed by some of the Medicare rules. And to convince you to come with us, we are going to offer things that traditional Medicare does not offer: dental, health, dental, ears, and eyes. we're going to offer those things. And we are going to also kind of eliminate that 20% burden. Some of us do, that 20% burden that you have to pay. And in doing that, we also convince the government, that you are going to pay us about 20% more. Remember what the deductible is already 20%, right? But you are going to pay the amount of money you're going to pay for Medicare Advantage for every person would be about 20% more than it really costs overall Medicare. But not only that, you would allow us to categorize how sick the patient is. And based on how sick the patient is how much we are going to tell the government you should give us for each of these people that we insure. And we are going to have outside companies come up and teach us how to make people look sicker to the government, but more healthy to the insurance companies. So they make a ton of money on your back. Like I've always told you, capitalism is nothing more than antiseptic slavery. So when Jack Van Beber goes up on that freeway and he sees that sign that says 0 premiums for Medicare Advantage, it is partially true. According to the AP now, there is a catch. The adage that nothing in life is free applies here. The plans charge no premium, but most people who qualify for Medicare still pay a monthly cost for the program's Part B, which covers doctor's visits and other outpatient care. That usually comes out of your Social Security check and will totals up to $164 next year. So they're smoke and mirrors that they come to you, get you to sign up. Once you sign up, you're in, and they bill the government for the thousands of dollars per month for you, whether you get care or not. And then many times they stick you with doctors, not your doctors that they have on contract that are trying to get through Medicare Advantage people like cattle, meaning you don't get good care because they have to pass 50, 60, 70 people through their offices no matter what. So the doctor comes in, sees you for 15 minutes, say goodbye. Another person comes in, the doctor sees you for 15 minutes, goodbye. And you have doctors that are paid and then they're monitored with their performance. I mean, it's a racket. So my contention to you again, for all of you over 65 that are on Medicare, and those of you that are under 65 that because of disability qualifies for Medicare, please do not. If you have any extra bucks in your pocket, think about your health first. Think about going for Medicare, traditional Medicare, and not Medicare Advantage. And if there are any Medicare Advantage salespeople listening to me right now, and saying, oh, my plan is very good, except please feel free to call me. I'll be more than happy to discuss this issue with the best salesperson of Medicare Advantage. So please feel free to call Politics Done Right at 713-526-5738, because I'll prove no matter what you sell, that what you're selling is a racket to the good people of America, to the great citizens of the United States of America. You are ripping them off. You are, in fact, to some extent, by selling them what you sell them, you're putting their lives in danger. And for the big profit you get for every single sale, some of these guys make over $2,000 and sometimes more just for selling you a policy. That's why they'll take you to lunch. They'll take you to Luby's. They'll take you to breakfast, and they'll take 10 of you at one time. And then they'll say, sign this up. This is good for you. And you get a belly full and you feel, I got me a free meal. And for a free meal, they've gotten your $10,000 from the government for your health care, which they don't give you much for that result. Any salesperson want to call, please feel free. I would love to hear from you. Let's see, for the listeners, for my listeners over 65 that are getting ready to take Medicare, let's see how many calls come in from the great insurance companies that are fooling you to kingdom come. Please call 713-526-5738. 573. And by the way, you can also, folks, tell them to contact our 3 o'clock show if they are asleep right now and they're trying to convince you to get that policy. Have them call our 3 o'clock show. Anyway, folks, Jack Van Viver again hijacked Politics Done Right by bringing up a subject that was not on the menu for the show today.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number 1, subscribe to our channel, and number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.